Hi, how are you? Korea. Bye சொல்லிரு.
Bye.
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 நல்லா படிங்க சொல்லு. நல்லா படிங்க சொல்லு. படிங்க சொல்லு. ஆல் த பெஸ்ட். ஓகேவா கொரியா? ஊடு. நான் கொஞ்ச நேரம் கழிச்சு வரேன் அப்பா. பாய். So welcome back to another study with me session. So those who are willing to join can join this session. This session is all about so I'm going to read on my own. The persons or the students who are joining with me on this study with me session can read on their own schedule. So I'll give a small pep talk at the beginning and also some motivation here and there. Okay, so hope you are all doing good. Hope your day went well. So I'm Dr.SJK, seeing you all for yet another study with me session. So it's already, so we call it the financial year starts by April 1st, right? So all the companies, all the pharma companies, every corporate side has April 1st as their first day. Similarly, as being PG aspirants for INICET as well as NEET, our deadline is also starting on April 1st, because if you are aiming for INICET, you are having another 50 days. Okay, if you are aiming for NEET, we are having less than 3 months. Okay, so it's a noticeable deadline being an aspirant. Okay, so you should all burn your fuel as much as possible. So give it the best shot as much as possible from your side, so that it will be a great preparation. So whatever it may come, it may be a seat that you are eager about, or it may not be the seat, but you, being the individual, should not be the loser. So you should give up whatever you have in yourself. There should not be a situation where you feel that um, I didn't prepare well, so I didn't get my seat. Okay, so I've given my best. This is what I deserve. Let me go for it. This is what should be the situation that will make you feel comfortable. Okay, so some may feel that, sir, I'm not getting proper grand test scores. I'm not getting. I'm not coming to a good rank, a decent rank in these full tests and all. So no worries. Okay, so the thing is, I am pushing everyone out here. So I am seeing a lot of students day in and day out with a lot of yardstick of their preparation. Some are very brilliant, some are very good enough in their preparation, some need that spark, some need that motivation. So any kind of preparation phase you may be in, but for the next 50 days for INICET, that should be the first checkpoint from your side. So the first checkpoint should be, you should be yourself, you should give your best shot. So whatever rank you get in INICET, that should be the rank that decides your potential. That should not be like that, I didn't study well so that I didn't get my rank. It's not like that. So give your best shot. So have INICET as your best exam. So either you get a good seat in an institute, or you may not get a good seat, but you will get a good learning from INICET. That will be very much precious for NEET PG. Okay, so aspirants who are aiming for INICET, who are not aiming for INICET, for all the people out there, INICET is the test, is the important test in your preparation, because you just consider May 19, June 22. So it's hardly what to say, it's hardly 1 month between the INICET and NEET PG. So that is picture made for INICET. So you consider yourself, you are giving good first revision or second revision before INICET. You are giving INICET as your best exam. You are giving it all that you have in yourself. So you will get a rank. No, you assess yourself which has come out good, which has not come out good. Then you could freshly make a schedule for the next 40 days for the NEET PG. Okay, so that's how it works. If you don't consider INICET as an exam now, you may lose the trick. So please consider INICET as an exam. Keep it as a deadline. Before INICET, I should finish one revision. I should give the test as my best test. You consider INICET as a GT. You don't give. If you are not so confident enough, at least give INICET test as a grand test. Okay, you will get to feel that exam atmosphere. For me, I was feeling that I have read well. I have given ample amount of revision. So this INICET, this aims itself, I'm going to get my dream PG seat, but that's not the case. So I was not having adequate time. So things were not working out for me. So INICET aims paper became an eye opener for me. So only after aims, I was very sure that this is not enough. The preparation is not enough. I'm not in a good state. So I should iron out all my problems. I should come out as a good individual. Then I should read again for the next 40 days. I did that. I got 22,000 rank in aims. Okay, I got 4,000 rank in NEET PG. Okay, so the difference was I was able to pick up my weak area, my problems in my aims exam. So even in JIPMER I got 2,500 rank again due to the correction of the mistakes which I made in the aims exam and JIPMER exam. So you should also do that. So please don't consider INICET is not my cup of tea. So you should consider INICET as your deadline for you to refurbish your preparation, to test yourself. It will be a good test of choice to bring out your inner potential to the core. Okay, fine. With that note, we can start this session. So anyone having any relationship issue, motivation issue, any financial issue, you can easily reach out to me. You can ask me anything. I'm surely going to help you out. Okay, let's start the session. Let's read it. Move phone to my clinic phone. I'll take it now. Sorry for the interruption. Hello? Hello? சொல்லுங்க. நைட் என்ன போடுங்க. அது எப்போ முடியுது? அதை முடிச்சுட்டு போடுங்க. So it's been 30 minutes since the session has started. So yes, my pep talk. The thing is, so there is three things. We are having a goal for ourselves, either a dream PG seat in INSET or NEET PG. So we are having a goal for ourselves to achieve. So we are all very eager and we desire to achieve that goal, right? Second one, for achieving that goal, you need a proper journey. That is your schedule, planning, and execution, whatever. So the journey is pretty important to achieve your goal. For having a good, efficient journey to achieve your goal, you need healthy habits. What is a healthy habit? See, your mind is not a matured person to listen to whatever you talk with it. Okay? Hey mind, you just sit here and study for 3 hours. Your mind will not do it. Okay? What you should do? You should settle in with some good healthy habits. What are the good healthy habits? First, you sleep at the proper time. So though you would have studied 10 hours for that day, for that reason, please don't use mobile phones or social media feeds at late in the night. It strains your eyes. The blue light will diminish the melatonin production and your sleep will be affected. So after 11 o'clock, please don't see the phone screens as much as possible. So you try to especially don't see the phone screens at a dark light. Okay, so bright lights quite okay, but dark light don't see that. Your melatonin production will be hampered, so your sleep will be absolutely affected. Okay, so have a proper sleep schedule. So if you are planning for sleep by 11:30 p.m. now, you should sleep by 11:30 p.m. Okay, you should not change every day. So that is a healthy habit. Sleeping at a fixed time is first healthy habit. Then having a good proper food at proper time is second healthy habit. Third, you plan a schedule. You sit in front of your material, you study. Though you may not be able to complete the schedule, but you should be disciplined enough to read for that 3 hours. So you have planned yourself to read for 3 hours. Whatever happens, whatever distraction you get, you should try to read for the 3 hours. If you don't do that, you are not sticking to a healthy habit. If you are not sticking to a healthy habit, you are not having a good journey towards your goal. The first thing, either you make a schedule in a paper, and mind schedule itself enough. Okay, so split up sessions like 2 to 3 hours session. So you should have at least 5 sessions like that. Okay, 2 hour session or 2.5 hour session, at least 5 sessions per day. So you have a good session, concentrated session without any distraction. Please don't listen to social media notification during that time. Okay, so stick to healthy habit. Once you stick to healthy habits only, you will have an effective journey towards your goal or target. So once you are having or started going in a healthy journey, effective journey, surely no one will stop you from achieving your goal. Okay, so you are responsible for your habit, you are responsible for your good journey, then you are the reason for achieving your goal. No one can do that for you. So you are going to do it for yourself, or else you are going to land up in trouble. That's all. So that's the motivation that I could give for you. So get back to your studies. I'll have a small coffee. Okay, I've entered the session immediately after entering the home. I didn't refresh myself, so I'll have a small coffee and I'll come back in 2 minutes. Okay.
side light இருக்குது.
So I'm going to have a strong coffee. So to read till 12 o'clock. Okay. So sorry for the interruption. I started the session straight away coming from the clinic. So that's why. Okay, fine. So how to get obsessed with reading? So I don't consider myself obsessed with reading. I have one good habit. If I have a deadline, I will be finishing that. If I don't have a deadline, I will never care about that. We all have that habit. So we will study well for our university exams, but we will not study in between. Similarly, so I will tell you a strategy. So this is deadline learning. So you indulge your mind with some made up deadlines. Made up deadlines that should not be insignificant. You should make the deadline as significant. For example, I will tell you my story. See, I'm not a main batch student. So final exam they have failed me. So I'm a intermediate batch student, odd batch student. My dream is to crack the NEET PG immediately after finishing my house citizenship, which is not main batch, odd batch. So October I'll be finishing my house citizenship. January I'll be having my exam. Okay, hardly 2 months. So 2 months or 70 days. That's all. So of course 70 days it's not enough for a reading. Even revision itself that's not enough. But what I have planned is to read fully during the entire house citizenship period. Read for at least 6 hours a day. Okay, but the important problem is I lacked practice. I can't write INESET. That's why I'm pleading you people to write INESET with a good focus. I was not able to write AIMS exam, zipper exam 6 months before the NEET exam because I am an odd batch student. I don't have eligibility to write that exam. So I wrote exams only after I completed my house citizenship. So that can't be a good practice for my NEET exam. So I don't know where I am standing. I don't have, for example, it's like I am not having a proper math practice. So I was I feared. So I thought of giving myself. Okay, let me make this concept very clear, and also I put this video in the group also. See, look at me. So if you are very idle in your thinking, you will not try too hard. Okay, so if you are having a deadline around the corner, your mind will be focusing too much. For example, university exam, your mind will be spot on. It will be focusing as much as possible for you to study in that limited time period. Similarly, I will set some made up deadlines. For example, I was not able to write AIMS exam, SIPMEN exam because I was a odd batch student. So but still I don't know where I am standing, whether I am reading correctly or not. So what I did now, I used to participate in online quizzes. For example, one college, PIMS, I think, Pondicherry Institute of Medical Science college, I think. So they used to conduct online quiz, okay, connection quiz. So 7 o'clock daily they will put upon an image based clinical question. Okay, sharply at 7 o'clock they will put up in their Facebook page. The one who answers correctly first, okay, will be given points. So it will happen over a period of 30 days. At the end of the 30 days, who is having more points will be awarded at their college. So I have no idea I'm going to get that or not, but every day 7 o'clock I will be very much focused on answering that particular connection. It will be very tough. Okay, I answered 2 times, I was not in the top 5. So but every day I will create a made up deadline for me. So I should answer this. If I answer this, I will feel happy. Like that, I made up I created a made up deadline. So every day I try to answer that question. Out of 30 questions, I answer only 2. But every 30 questions I studied daily. So many questions will be from basic sciences, biochemistry, physiology, anatomy, like that. So I studied for 30 days. That was a great motivation for me. It was created by me. So I was surfing in the online to have such opportunities. I had that opportunity. After that, there was a quiz competition happening in Vellore Medical College. So usually the one college which is hosting the quiz competition can accept participants from whatever batch. In my batch, we 3 were odd batch students, Makku students. Okay, so the quiz is integrated reproductive system. They will ask questions from all reproductive system topic, anatomy, physiology, OBG, everything. So I set deadline for me. So I should finish entire reproductive system within that quiz. So I did that. I competed with CMC Vellore students. I competed with JIPMER students. I stood first place. I was a Makku Payan. I was a failed student. Now I'm doing my house sessionship. During my house sessionship, I attended that quiz. I stood first place in the state. So that was a big motivation. So it was a made up deadline. So I was not supposed to do that. So I would have left as it is, but I created that opportunity to create a competition among other fellow students. They may be MBBS students, but still they have that stuff. No, I competed with them. I gained confidence from that incident. Next month, I again participated in a Tanjore Medical College path quiz. Next month, I participated in a Stanley Medical College path quiz. So I was not able to write exam, but I created a situation where I could have competition with all the students. So the deadline made me to study despite my house urgency hectic period. Okay, so that's what I'm asking you people. So the grand test, daily test will create an artificial deadline that makes your mind to think better, focus better, and time management in a great way. So that's how you should think of writing this test. So yeah, flat line of preparation is not going to help you. It should be filled with all emotions, stress. It will be there. Once you go through that only, you will come out successfully. So that's what I would advise getting into this so time is 10:30. We can read for next 1 hour and have the send off. So till 11:30 this session will extend. Okay, I hope it was useful. Okay, so like some small chit chats I will have here and there. Okay, so I'm having one phone call regarding tomorrow's class for NEET UG students. I will answer it. Sir, நான் தான் பேசுகிறேன். சொல்லுங்கள் சார். நாளைக்கு ஆமாம் சார் 1 to 2 இன்னைக்கு மாதிரி எடுத்துக்கிறேன் சார். ஈவினிங் மட்டும் கிடையாது. 1 to 2 1க்கு வர சொல்லிடுங்க, 2க்கு முடிச்சிடலாம். டெஸ்ட்டு இன்னைக்கு மாதிரி நான் உங்களுக்கு மெட்டீரியல் அனுப்பிச்சிடுறேன். டெஸ்ட் இருக்குது. 2க்கு மேலே எழுதலாம் போதும். ఓకే. చూద్దాం సార్. So the tomorrow's class has been finalized. got a call regarding a case. I'll just answer that. Sir, another question, sir. Okay, sir. Okay, sir. Okay, sir. அப்படி வராதே சார். No sleep, sir. இப்போ ப்ளீட் குறைஞ்சிருக்கா? பரவாயில்ல. ஸோ இப்போ அட்மிட் பண்ணிடுங்க. அட்மிட் பண்ணிருக்கீங்களா? அட்மிஷன் நீங்கள் அட்மிஷன் போட்டுருங்க. நாளைக்கு வந்து நான் பார்த்துட்டு ஃபாலோ பண்ணிக்கிறேன். நான் எண்டோஸ்கோப் போட்டு பார்த்துட்றேன். பார்த்துட்டு செக் பண்ணிக்கிறேன். ஓகே. These kind of distractions, please don't mistake me. Being a consultant, I will get some emergency calls that I should answer that without fail. If you don't answer that now, patient is patient will suffer. Okay. Third thing, so it is my bread and butter. I should do that. Okay. So please don't mistake. time is 11 o'clock. So already 1 hour 20 minutes into our session. Okay. So we what shall we do when we feel like so no I can't do it. So I'm getting very sleepy. So this is my limit. See, it may sound filmy, but have you heard of this famous Muhammad Ali quote? He will start counting. It's Muhammad Ali or Bruce Lee? I'm not sure. Sorry. They say that he says that he will start counting his push-ups only after he feels pain in his arm. Which means that he would have done some 100 or 200 push-ups before getting pain. But only after getting pain he will count the push-ups. That itself will go for 100. So the effort that you put, bearing all the vagaries, like you may get sleepy, your back may be straining, eyes may be straining, you most importantly you will feel hungry. Okay. So I could eat something like that. You may think like that. Okay. But you should feel yourself like a monk. Okay. A monk who is not yielding to the situation around him or her. So you should be like that. So only if you are like that, you are ready to achieve the glory that is going to come in front of you in a matter of 2 months. Okay. So what you should have some pickup word. There's pickup line you heard of, no? Pickup word. So what if you utter that word, you instantly should get charged, and you should focus more. So what I'll do now, so I used to be in the cricket team in my college. I play. Okay. So I'm getting some command from one of my relative. Okay. This is a study session dedicated for students. Okay, fine. So what I'll do now, whenever I feel very low, I am running out of my energy, I'll say, "Come on, boy." Whenever I say "Come on, boy," so in cricket field, the fielders who are standing at the gully or point position, "Come on, boy, come on, boy." Like we'll appreciate the bowler to generate more pace. Okay. So I started using that word right from that period. So I'll always use that word "come on, boy." If I use that word "come on, boy," so I'll get more energy, I will feel pumped up, and so these late hours of the day I'll regularly use that word. So "come on, boy, come on, boy." So you can have such word that will bring instant energy for you. So that energy makes you feel excited and energetic during these odd hours of day. So like late night or early morning, when you feel very sleepy now, you could use that thing. So see, three of them are in the live session. Okay, yaar idu? I'll catch you. Okay, I don't know who is this, but I'll tell you. It's like so. Study with me session, yeah. So those who are asking question, study with me sessions. So I'll be starting daily this session by 9:30 to 11 o'clock. Sometimes it may drag up to 11:30. Okay, I am a doctor, so I am conducting this session for my students. Some one or two may join, some may not join. Okay, but the idea is they will be reading on their own. I will be reading on my own. So we are just having a mutual study session so that they will not feel depressed or demotivated. So that is the idea of this session. Okay, I hope you understand. So I thought you are my relative or something who is teasing me. So now only I saw your profile. You are a small girl. Yeah, I teach for NEET UG and NEET PG. Okay, so you randomly entered my live session, I think. So this is how it works, part. Okay. Did you understand what I just tell? Okay. Okay. That's okay. Study well. Okay, then you can study. Okay. So your exam is round the corner, no? So it's hardly less than 2 months for your exam, I think. So please read as much as possible. These are precious days of your life. If you read well, you could score well. You could get your good college of your choice. Okay. Please read well. Don't waste time. Okay. So read as much as possible. That's my kind advice. Yes, you can ask. This is session for all students. Any student can join. You could ask anything you want. So this girl who was just completed 12th standard, she has asked question: in medical line, which course is best for future 12th grade students? Yes. So if you are scoring well, of course you will be getting MBBS. Okay. If you are scoring well now, you could choose MBBS. So if you are not scoring well now, there are other specialties of medicine such as bachelor in Ayurveda, bachelor in homeopathy, bachelor in veterinary science. So these three also you could choose if you want yourself to be a doctor. Okay, so all of them are also practicing. So you could choose that Ayurveda, then homeopathy, or else veterinary science. Okay. No, so I don't think it will be having a good future if you think like that now. You could choose some paramedical courses such as BSc nursing. So not only BSc nursing, nowadays a lot of courses, 4 years courses have arisen like BSc operation theatre technician. It's very demanding field. You could choose that. It will be very helpful for you. You could work in any corporate hospital or government hospital as a theatre technician. It will be a respectable job. BSc OT technician job. So that OT technician course that you could take, or BSc anesthesia assistant, physician assistant, or dialysis assistant. So if you go to any, I don't know which state you are from. So in your state there will be a website for your medical university. In that medical university you could choose. Yeah, I know that you just completed 12th grade. I know. So you could choose BSc paramedical sciences, any paramedical sciences. Good one is operation theatre technician. The second good one is radiographer, radiology technician. The third one is BSc nursing, of course. So these three courses I would recommend for you. So operation theatre technician, BSc nursing, and then this radiology technician. So these three courses you could take. Yes, I have completed MBBS and Masters, MS. I'm a specialist in ENT, ear, nose, throat. I'm a specialist in ENT. Okay, thank you. So you read well. All the best for your future. I'm reading for tomorrow's class. I'm going to take class for NEET UG students who completed 12th standard. They're writing the NEET exam on May 5th. So I'm preparing for the class which I'm going to take for them. Okay. So tomorrow's class 1 to 2 p.m. So I'm reading for my class. Those who are joining this session can read whatever they wish. So to avoid distraction, I am conducting these sessions. It's a very famous thing. Everyone used to conduct this study with me sessions. Okay. So if you feel like you are not getting adequate motivation for your reading, so you could join the session by 9:30. 1.5 hours, you will not get distracted to anything. So you could read. So this session will be useful for that. if you like JEE na, you go to that field. If you like NEET, if you want to become a doctor na, you want to study for NEET. But whatever we think for JEE as well as NEET, you are having only little amount of time. So my advice is, though you are Max Bio group, so read for JEE for the next 2 months. Okay. So you read for JEE for the next 2 months. You try to give JEE to the fullest of your potential. Okay. So NEET, if you start reading from now on, you may not get the seat. You need to read for 1 full year, so that only you will get seat in NEET exam and you will become a doctor. So my advice is, now you could read for JEE with full effort. You could have a good seat at JEE. Okay. So please proceed with JEE. If you want to start reading for NEET now, you could start after completing this year's exam. You read for 1 full year. Okay, okay, if you are having only 4 days for JEE na, you could read for JEE. Then you will be having 1 month for NEET exam. So you are saying that you are a bright student. You could read 1 month for NEET exam. You may get. It's not that you may not get. You give your full potential. You read for 10 hours per day for 1 month. You may get the seat. At least you try. Okay. You may get or you may not get. After JEE exam, you please read for 1 month for the NEET exam. You may have some chance of getting the seat. Okay. After getting the result, you can decide whether you have to spend 1 more year for reading JEE or NEET, or you are going to join your college with the marks that you have already got. That's not a problem. Though you have not read 11th na, no problem. You get some review book. You solve many questions, 1 mark questions for the next 1 month. You will have some idea. You may score well also. It's not that I have not read 11th, I may not get. It's not like that. You get some book. You read for 1 month. You will get some rank. Then you decide whether you could go for this or you could give a try for 1 more year. Okay, I will explain later. Now I want to clarify one doubt from my student. So Sampurna, please listen to me. So facial nerve course, the important points that you have to remember with facial nerve courses: it starts from pontomedullary junction. It makes a curve around the abducens nerve, that is called facial colliculus. That facial nerve from the intracranial course slowly enters into internal auditory meatus. It forms relation with other nerves such as cochlear nerve and vestibular nerve, that we call it as Bill's plot. The diagram is very important. Then the facial nerve enters into the temporal bone. It is divided into 4 portions. Intracanalular plot, that is the inside the course of the temporal bone, we call it as intracanalular part. Then labyrinthine part. Then we are having horizontal part or tympanic part, mastoid part or vertical part. These 4 are the subdivisions of the intratemporal course of the facial nerve: intracanalular, labyrinthine, then vertical or mastoid part, out of which each part has some significance. Intracanalular part is around 5 to 8 millimeters length. This labyrinthine part is very important. It is shortest. It is not lined by any bony covering. not lined by any bony covering, so it is more prone for injury. So this labyrinthine part more prone for injury. It is not having any branch. The transition from the labyrinthine part to the tympanic part, we call it by first genu, and also geniculate ganglion is found over there. From geniculate ganglion you will be having GSPN, greater superficial petrosal nerve, and from the tympanic part you will not be having any nerves. I repeat it, first branch from the intratemporal goes, there will be greater superficial petrosal nerve arising from the geniculate ganglion. Horizontal part or tympanic part you will be not having any branch. From the masstoid or vertical part you will be having two branches, one is nerve to stapedius, another one is cauda tympani nerve. So three branches from the intratemporal course of facial nerve, very very important. GSPN is for lacrimation, nerve to stapedius is to avoid hyperacusis, then cauda tympani taste sensation over anterior two-thirds of tongue. The nerve comes out of the stylomastoid foramen. It gives two branches, posterior auricular nerve, nerve to digastric. Then it gives 5 terminal branches, temporal, zygomatic, buccal, marginal mandibular, cervical. These are the 5 terminal branches of the facial nerve. So 10 zebras bit my cat is the mnemonic for this terminal branches of the facial nerve. Is it enough for you, or do I need to elaborate more on that, Dr. Sampurna? Okay, I hope you got it. Okay, keep reading. Thank you. So I'm sorry for this regular study session. So one 12th girl is asking me a lot of questions. I'm just answering her. Please don't get disturbed by it. So Queen Baby Star Vlogs. So it's your wish, ma. So if you want to achieve if you want to get into good college, if you want to get into good JE seat, na, you want to read for one more year, then only you will get good seat. Okay, so reading for 1 month is not enough for NEET or JE. You should learn some more time also, so that you will get good seat. So this time you read for the JE for this week, then NEET exam for 1 month. You try which rank is you are getting, then you decide whether you are going to study for 1 more year or you are going to join college with this mark itself. Okay. So it's very nice talking with you, little girl. So she's asking, she has read health and diseases chapter in zoology. So she is thinking that she is getting the disease. So this is very common. We call it as resident syndrome or first year syndrome. When we newly read about some disease during MBBS also, the first year and second year period, we will think that we are getting that disease. Okay, so it is called resident syndrome or first year syndrome. That is very normal only, ma. So you should read further about that. You should have some clarity in knowledge about that particular disease. Then only you will make sure that I am not having that disease. So you are very curious to know a lot of things. I'm open to answer you. So that's the explanation. Even our MBBS students also have that problem. So unless otherwise they are entering into the internship period, they will have that problem that whether I am having the disease or not, like that. So you are getting the disease now. You have read well. Good, good. So are you able to follow my English? Okay. So I think you are from some other state. So I think you understand my English. Hope so. தமிழ்நாடு வந்தியா? Then okay. அப்போ தமிழில் தான் சொல்லணும்னா சொல்கிறேன். ஸோ செஷன் முடிக்க போகிறேன். வேறு டவுட் இருந்தால் கேளு. ஸோ எங்கள் ஸ்டூடெண்ட்ஸ் ஃபுல்லாமே வெளியே போக ஆரம்பிச்சிட்டாங்க. ஸோ கம்மியாக தான் இருக்காங்க. எதாவது கேட்கணுன்னா கேளு. Okay, study well. Okay, all the best for JE exam. Write well. Okay, all the best. So I will finish this session in another 10 minutes. Thank you. For information, the topic I am preparing is respiration and gases. Tomorrow's topic is respiration and gases. That will be projected live in this channel also. Okay, respiration and gases is the topic for tomorrow's class. I am preparing for that. Sampurna, the thing is, what is that? So the question is why recruitment is seen in cochlear hearing loss and CC score is more. uh, so cochlear hearing loss, what is happening now? See, if the cochlea is a coiled structure, every particular part of the coil is assigned for a particular frequency. For example, if you look at this as a coil of a cochlea, if this area is assigned for one particular frequency, say for 1000 frequency, this area is assigned for 900 hertz frequency. Okay, so when you are having a cochlear hearing loss such as Meniere's disease or age-related hearing loss, if the Meniere's disease affects this particular area, for example 900 hertz frequency hair cells are damaged. So this 900 hertz frequency hair cells are compensated by higher frequency hair cells called 1000 decibel hair cells. So the compensatory activity by higher frequency hair cells, because it is a low frequency hearing loss. So low frequency hearing loss will be there. So higher frequency will compensate for low frequency hair cells. So due to that phenomena, the patient will not hear for the lower order frequencies such as 250, 500, 750. The patient will not hear. But suddenly the patient, when hears 900 hertz frequency, instead of hearing no sound, he will hear a sound which is more than usual. Okay, so sudden growth of loudness is called as a recruitment phenomenon seen in cochlear hearing loss, because in cochlea that particular hair cells are affected which has been compensated by higher frequency hair cells. That is the reason for recruitment phenomenon. Okay, did you understand recruitment phenomenon? If you understood recruitment phenomenon, I will proceed to CC score. Did you understand? So recruitment, yes. So recruitment of higher frequency hair cells for lower frequency hair cells, that is making the lower frequency hears more than usual, just sudden growth of loudness. Now CC index. If I do CC index for you, CC means short incremental sensitivity index. So we usually conduct CC index not for lower decibel sounds, usually for higher decibel sounds. For example, if your PTA threshold is 50 decibel, we will conduct this CC index more than the threshold of the patient. Okay, if I do CC for you, your PTA threshold is 30 decibel. Now for Sampurna, I am going to increase 1 decibel sound, incremental sound, for every 5 seconds. You close your eyes. Sampurna, I am increasing the sound for every 5 seconds. 1, 2, 3, 4, 5, 51, 31 decibel, 6, 7, 8, 9, 10, 32 decibel, 11, 12, 13, 14, 15, 33 decibel, 16, 17, 18, 19, 20, 34 decibel. So like this, if I increase the decibel, okay, if I increase 1 decibel for every 5 seconds till I does this for around 20 times, okay, 20 times I am slowly increasing, that is incremental sound, increasing the sound 20 times. I ask Sampurna, see doctor, how many times I have increased the sound? Can you tell me? You can't increase the sound to 20 times because our ears are not that much sensitive for small incremental sound. 1 decibel our ears can't find out. Maybe for 5 decibel, maybe for 7 decibel. So 3 to 7 decibel only our ears are sensitive. So at the end of 20 incremental sounds, you will say that, sir, I could hear incremental sound only 4 times. So 4 times out of 20, what is the percentage? So you hardly got around 20%. Or sometimes you may say that sometimes you may say 20%. If you say 5 times, so what is for 5 times now? It is around 25%. So if I do this CC index for normal persons like you, it should be around 30% only. So you should not hear small incremental sound. Okay, so not hearing small incremental sound is normal, but the patient with recruitment phenomenon, even small, so I have told you I am doing this test more than the threshold, not for the damaged hair cell area. So I'm starting the test only after the 900 frequency range which I have told you. So I'll do the test starting from 50 decibel. I'll ask the patient, 51 decibel, do you hear the incremental sound? Yes. 52 decibel, yes. 53, yes. 54, yes. 55, yes. So out of 20 times, the recruitment phenomenon patient will say, out of 20 times, he will say at least 18 times. His hearing is less than what we have, but that is not a problem. We are starting the test from only, so that is not an issue here. But if the patient can tell 80% or to 90% correctly the incremental sound out of 20 times, he is having around 90% CC index. So CC index is higher na, recruitment phenomenon is positive. CC index 30%, it will be normal. Okay, so in retrocochlear deafness also CC index will be lower only. So this CC index is mainly for recruitment phenomenon in cochlear deafness. Did you understand, or do I need to elaborate more on this concept? Did you understand? Still, is it confusing for you? The percentage is, yeah, the percentage is tentative. I didn't tell the exact percentage. CC index higher na recruitment phenomenon, 70 to 100 they would have given in some books, 70 to 100. Okay, 50 in normal persons, 30 in sensory loss. That is not a problem. The concept is higher in cochlear deafness recruitment phenomenon. That is the concept that you need to understand. The values may be tentative, that is not an issue, but 70 to more than 70% or 70 to 100% in cochlear deafness, that is what you need to understand. So what but? You please tell what but. Okay. See, that's what I'm saying. See, you are not having hearing loss, so your hearing will be normal. So your hearing threshold will also be normal. So what is the hearing threshold of Sampurna? It could be 25 decibel. It is normal. You are having a normal hearing sound. So I'm starting this test. I'm starting to increase the sound only from the hearing threshold, which I found with audiogram. With audiogram, I found the threshold to be 26 decibel or 27 decibel per. So I'm starting from 26 decibel. I am increasing the sound 20 times for Sampurna, from 25 decibel to 45 decibel. Okay. So you are not able to hear the incremental sound. For this recruitment phenomenon patients, for example, in Meniere's disease, it is a low frequency sensory neural hearing loss. Okay. So in low frequency hearing loss, 100 decibel hair cells affected, 250 hair cells affected, 500 decibel hair cells affected, 750 decibel hair cells affected. So all low frequency sound and low decibel sound such as 10 decibel, 20 decibel, 30 decibel, 40 decibel, the patient will not hear any sound. But when he comes at the threshold level of 50 decibel or 60 decibel, that is an area where the low frequency hair cells are recruited by high frequency better hair cells. So at that particular point of time, his hearing is matched up by a lot of higher frequency hair cells that will give a lot of better sensitivity. For example, so at the 50 decibel, 1000 Hz frequency, if I am doing the test for this patient, the patient is having more activity from higher frequency hair cells that looks like he is able to sense small increments. Okay, so this is not better hearing, this is just able to receive incremental sound. That is because of higher frequency hair cells matching up for a low frequency hair cells. That makes the incremental sound hearing possible. So the recruitment phenomenon is making this possible? Your question is very clear. How hearing loss patient can do this? It is possible because of the phenomenon called recruitment phenomenon. So that is a strange phenomenon that makes things like this possible. Okay. So I have never seen this test pass. So we will not do this test. Mostly these are all theoretical. Okay, fine. So what you are reading, Sampurna? What subject you are reading? Have you replied my message? What is your schedule for the next? So you are reading ENT, I think. What is your schedule? Okay, you could text me. You text me a schedule. So you could text me some. Okay, you proceed with PD and ENT. If you have any issues with your schedule or planning or execution, you could text me anytime. Okay, fine. So the time is getting close to 12 o'clock, so I am going to finish my session. Okay, I'm going to sleep. I have completed almost most of the topics I have planned. So happy reading, Dr. Sampurna. You please be reading. I think you are still having your session. Okay, thank you.